Teja, Director of Operations at the Vivacare Medical Group in Surrey. Aleem has worked in the public health care sector for over 15 years at the Vancouver Coastal Health Authority, the Provincial Health Services Authority, and the BC Women and Children's Hospital. He joined Vivacare in 2012 and was appointed Director of Operations in 2014. So there you have it. Pretty good.
Interesting perspective. I think first off, I credit the four presenters we've had already, the two up here, the two that presented before, and as you can see, there's a lot of passion. And with Vivacare and my role at Vivacare as the operations guy, we have 11 clinics across the Lower Mainland, all function in a hybrid model, as Yvonne talked about earlier this morning. But we care. Okay? I think we understand the pressures with the passion that's come out this morning, whether it's physician intake, and let's not be blind that we're not getting more physicians as we spoke about, whether it's the cap, or whether it's the MSP payment, or whether it's the misconnotation that the government has or the college has when it comes to walk-in clinics being a business and a money-making business. I came from the government, the public sector. I have been unfortunate and fortunate to have perspective of family members going through health challenges and dealing with the pressures of finding a walk-in clinic because their family doctor's too busy, etc. And I got into this business, or I got into Vivacare because we care. And as physicians, you care, and as managers, you care, and as everybody here, we care. And we want to be part of the solution. And I think we're, the passion coming around with the challenges that we're facing, which is well documented. We're going to spend the rest of the day talking about solutions that we have for that. But at the end of the day, from my experience with the government and with health authorities, walk-in clinics service a way to alleviate the pressures on the hospital system. And I think that's an important understanding to have. And I'm an analytics guy, and I came from a department that looked at analytics for Vancouver Coastal Health. And if you look at our model at walk-in clinics, as you see in the morning, between 6 to 9 a.m. is when we see our spike in interest in a walk-in clinic. Between 12 and 6 p.m., you see the spike when you go into the emergency room, and thereafter. And the cost of that on the healthcare system is significant. If you do the analytics around the cost of a patient coming to a walk-in clinic to see a doctor versus going to a hospital to deal with a very simplistic issue because they can't see their family doctor, or the walk-in clinic down the street is closed, I think that's where the focus needs to be, being part of the solution to address that bottleneck that is there in the model of shutting down walk-in clinics because they've hit their cap, regardless of shutting it down because the doctor doesn't want to do it anymore, or they're retiring because they hit their cap, and then that pressure being pushed out to other areas which are more cost, and the implication is far higher. The other issue I want to address is providing healthcare the right way. Right? We have a passion, we have economies of scales within our many clinics, and even though the business analytics of doing healthcare based on new regulations imposes a significant impact on our bottom line, we have a passion to do it. And I hope that we can come up with solutions so that every clinic can do that as well. Because I know the traditional non-physician owned walk-in clinics, they may not have that similar passion. But when you have physicians involved, like most of our clinics with our board, we have that passion, and issues that I bring up are simple things that Yvonne talked about: continuing longitudinal care, providing records to that family doctor. The college came out with rules asking for consent, which is written, which creates a process for each of our clinics. Let's say they see 100 patients, 40% of them are walk-in. So creating that dialogue with the patient on those 40 creates a significant workload impact on our frontline staff, which we have to compensate for the great time, and reduces the economics of making that a profitable walk-in clinic, which everybody seems to have the connotation that we're out for profit. So the thing I just wanted to say in my opening statement is that we care, we have a passion for providing better healthcare to our patients, and being part of the solution, and how can that be seen as a trigger point for walking clinics across BC?